An infodemic or scaremongering. Criticism is often leveled at the media for wall-to-wall coverage of the COVID-19 pandemic. But is it all that bad, and what can the profession do better under the current climate? Professor George Claassen joins me now. He is a public editor and ombudsman at News24. Good evening, and thank you so much for your time, Professor Claassen. I wonder, just maybe your reflections that made you get to the point where you were looking at what the coverage in the media of COVID-19 was, that made you feel like the media might actually be part of the problem here.
No, I don't think so. Thank you. Good evening. We're not part of the problem. We're the messenger of a very serious pandemic, and we're trying to get the information across about how serious this pandemic is, how many people are dying, are infected, and what steps we can take to avoid this or to keep ourselves safe. It's as simple as that.
Is there a point where, as the media, we can say that we've gone too far? There's just too much bad news, as lots of people are saying recently, that people actually have to switch off from the news in order to have some level of sanity?
Yes, you can probably say that. People get an over value of bad news. The problem is, should we avoid it? Should we keep quiet and so that nobody knows and everybody dies? There was a risk analysis, a leading American risk analyst who, during the 2006-2007 bird flu pandemic, who warned that the media should be prepared to scare people to wake them up. And I don't think we're scaring people. I think our information, at least most of the South African media I observe, are very vigilant not to scare people, but to give them the correct information so that they can take steps to make themselves safe.
Of course, it can be a delicate line to walk, because on the one hand, we're facing this unprecedented event that is taking place, and some of the details that come as a result of COVID-19 having hit this country are scary in and of themselves. So the details themselves can be quite difficult for people to process. What are the checks and balances that we as journalists have to make sure we're constantly applying to ensure that we're not adding to the fear or adding to the anxieties that people might have?
I think the most important factor in this pandemic at the moment is that we should listen to the scientists. The scientists have the best information available, and we are trying to understand what they are saying, and the media are in many instances the filters through which this information is put through to the public. The problem is, where the media fail quite often, is that we don't have enough science journalists. Science desks worldwide have been decimated by newsrooms because of the pressures the media are under. And that's the one place where they shouldn't cut money. This pandemic has shown it, that there should be competent science journalists who understand how science works, who can go to the primary source, and that is the peer-reviewed publications, the peer-reviewed studies, because that has been tested and that can be trusted. For example, hydroxychloroquine has never been properly cleared to be safe. It is safe for other measures, for malaria treatment, but no study has proven that it can help for COVID. And that politicians and ignorant quacks are punting it and trying to promote it is really dangerous, and the media should point that out to the people.
How do you think that this has contributed or affected the quality of reporting then on a pandemic like this, the reduction in having journalists who focus specifically on science, and even, I'd go even a step further in saying that health journalists who look specifically just at what's unfolding within the health sector?
Well, it comes from the 2008 financial crisis when, for example, CNN, who had a very strong science desk up to 2008, and they closed the science desk because of financial reasons. And now, and this is clearly shown during this pandemic, that science desks should be staffed with competent people, but the problem in South Africa, for example, there's not one South African media institution who has a designated science desk with the science editors. They've got medical reporters. Everybody at random are reporting on intricate medical science. And quite often these people are not well trained enough to be able to report on it.
Absolutely.